Welcome to the Deep Microbiology channel. Today we're presenting an informative video on sterile pyuria. Sterile pyuria is characterized by the presence of leukocytes in urine, without bacteriuria. It can be diagnosed with more than or equal to 10 white blood cells per cubic millimeter or positive leukocyte esterase on dipstick, without the growth of bacteria in standard urine cultures. What are the causes of sterile pyuria? It can be categorized into infectious and non-infectious causes. Infectious causes include Mycobacterium tuberculosis, sexually transmitted infections such as Chlamydia trachomatis, Neisseria gonorrhoeae, viruses like HIV and herpes simplex virus, fungi such as Candida, Cryptococcus, and parasites like Schistosoma hematobium. Non-infectious causes include inflammatory diseases, such as Kawasaki disease, lupus, sarcoidosis, malignancies like bladder or kidney cancer, and external factors like drug-induced nephropathy, immune suppression, and foreign objects, such as catheters, stents, and eosinophiluria. Epidemiology of sterile pyuria. It affects up to 13.9% of females and 2.6% of males. Higher rates are found in specific populations, including immunosuppressed individuals and those with appendicitis, an inflammation of the appendix, a small pouch attached to the large intestine, and diverticulitis, an inflammation or infection of diverticula, which are small pouches that can form in the walls of the colon. Diagnosis of sterile pyuria. A detailed clinical history and physical exam are essential. Tests include urinalysis, blood counts, and cultures for infectious organisms like TB and STIs, sexually transmitted infections. Imaging, CT, ultrasound, may also be used for conditions like genitourinary tuberculosis or stones. Complications. Misdiagnosis can lead to inappropriate antibiotic use, delaying proper treatment for conditions like genitourinary tuberculosis or STIs. This may lead to complications such as kidney damage or antibiotic resistance. Question and answers. Question 1. How can sterile pyuria be differentiated from a urinary tract infection? Unlike typical UTIs, sterile pyuria presents with white blood cells in the urine, but no bacterial growth in standard cultures. It may indicate infections with atypical organisms or non-infectious causes like systemic diseases. Detailed history, physical examination, and additional testing, for example STIs or TB, help differentiate it from a true UTI. Question 2. What role do imaging studies play in diagnosing sterile pyuria? Imaging, such as CT scans and ultrasounds, helps identify underlying causes like kidney stones, tumors, or genitourinary tuberculosis. For instance, renal calcifications or strictures on CT may point to TB, while ultrasounds can detect structural abnormalities like hydronephrosis. Question 3. Can sterile pyuria be a sign of cancer? Yes, sterile pyuria can be associated with genitourinary cancers, such as bladder, kidney, or prostate cancer. In some cases, it may serve as an indicator of tumor recurrence or treatment response, particularly in patients with non-muscle invasive bladder cancer. Question 4. How do sexually transmitted infections lead to sterile pyuria? Sexually transmitted infections like Chlamydia trachomatis and Neisseria gonorrhoeae can cause sterile pyuria because they infect the genitourinary tract but do not grow in standard urine cultures. These infections often lead to urethritis or cervicitis, causing white blood cells to appear in the urine without detectable bacteria. Question 5. What is eosinophiluria? This condition specifically refers to the presence of eosinophils in the urine, often due to allergic reactions, drug-induced interstitial nephritis, or certain infections. Eosinophils are not typically involved in bacterial infections, but can indicate other immune responses. Question 6. What are the conditions associated with eosinophiluria? 1. Allergic interstitial nephritis. Inflammation of the kidney interstitium due to allergic reactions to medications or other allergens. 2. Cystitis. Inflammation of the bladder, which can be triggered by allergens or irritants. 3. Urinary tract blockage. Conditions that impede normal urine flow can lead to eosinophilic infiltration. 4. Immunoglobulin A nephropathy, a kidney disease characterized by the deposition of IgA in the glomeruli, leading to inflammation. 5. Cholesterol emboli. Blockage of blood vessels by cholesterol crystals can induce an inflammatory response and result in eosinophiluria. 6. Contrast-induced nephropathy. Kidney damage resulting from the use of contrast dyes during imaging procedures can lead to eosinophilic infiltration. Question 7. What are the differences in similarity between sterile pyuria and eosinophiluria? Similarities. Both conditions show an elevated white blood cell count in the urine, indicating some form of inflammation or immune response. Both sterile pyuria and eosinophiluria can be associated with non-infectious conditions, such as allergic reactions or autoimmune diseases. Both conditions are typically identified through urinalysis, where an increased number of white blood cells are noted. Differences. Sterile pyuria generally involves neutrophils, a type of white blood cell associated with bacterial infections, but can be present without a detectable infection, while eosinophiluria specifically refers to the presence of eosinophils in the urine, which are typically involved in allergic reactions and certain parasitic infections. Question 8. Why sterile pyuria is popular in specific populations, including those with appendicitis and diverticulitis? 1. Inflammatory response. Both appendicitis and diverticulitis are inflammatory conditions. The inflammatory response can spill over into the urinary system, leading to the presence of WBCs in the urine, even if there is no urinary tract infection, UTI. 2. Referred pain. The location of inflammation in the abdomen can lead to irritation of nearby structures, including the bladder. This can cause symptoms that mimic a UTI, contributing to the appearance of WBCs in the urine. 3. Misinterpretation. In patients with abdominal pain and urinary symptoms, sterile pyuria can sometimes be misinterpreted as indicative of a UTI, leading to further investigations that may not reveal any infectious agents. 4. Associated conditions. Some populations with diverticular disease or appendicitis may have other underlying conditions, for example renal stones or other infections, that could contribute to sterile pyuria. Question 9. What are the appropriate comments in the laboratory result for a case of sterile pyuria? Please write them down in the comments section. Thanks for watching. If you enjoyed the content, don't forget to subscribe to Deep Microbiology channel and turn on notifications to stay updated.